A very good morning to everyone. Today we are gonna know about human skull. There is a brief information regarding the skull bones. This is the part 1 of the video, which is going to cover the frontal as well as the lateral aspect. The second part that I'll going to send you later, it will consist of the nerve supply, blood supply as well as the norma bizalis. So let's start now. This is the frontal view of skull. That is, when we see the skull from the front, we can see all these bones. So this is the frontal bone. As written over here, this is a pic of book that we normally read in India. This is the frontal bone. These are two prominent points over here that are called as frontal tubercle. After that, when we come straight down, this midpoint at the suture is called as nasion. This is a very important point, nasion, which we generally use in ortho for many measurements. Next, these are the orbits. Here our eyeball lies. These are the sockets, called as orbits when we talk about bone. Next, this is where our nose lies. This is called as the nasal bone. After that, when we come straight down, this is anterior nasal spine. There's a prominent point. When we touch, we can feel there's a spike over here called as anterior nasal spine. When we come down, so this is our alveolar bone, the maxillary alveolar bone. So these things, what are these? These are maxilla. Then what are these things over here, right here? These are our zygomatic bones. This all over here is a zygomatic bone. So what is this? This is a hollow space. When we see the orbit, these are superior orbital fissures. Then when we come down, when we see this is a foramen. What is this known as? This is known as intraorbital foramen. Then when we see these sutures, what are they? See, when you read this, try to interlink them. There are sutures. When two bones meet, that point is called a suture. For example, when we see here, this is a suture. Two bones meeting over here. What is this? This is a suture. This is a suture. So, these all are sutures. Okay? Where two bone meets, that's a suture. Like here we have written frontozygomatic suture. So how we are gonna name this? Frontozygomatic, break it. And suture is the third part. Fronto is this the frontal process. This is the frontal bone, and this is zygomatic bone. Zygomatic bone is having frontal process, and this is temporal bone. When they combine, they are called frontozygomatic suture. This is the frontal bone, this is the part of zygomatic bone. So they meet, frontozygomatic suture form. Then we come down. So the most important thing when we generally study in our first year, this is the mandible. Most of the question is asked from this mandible. So what is this? This is the bone that makes our lower jaw. This is the angle of mandible. Here lies foramen, mental foramen. There is a prominent point. This is called as mental protuberance. What is symphysis? Here the both part of mandible meet. This point is called as symphysis mentae. So this all consists of our frontal, and yeah, there is a one point over here called as glabella when we talk about soft tissue, but not in hard tissue. There is a colorful pictorial diagram of what we have studied just right now. Frontal bone, the orbit, nasal bone, the nasal aperture, These are the alveolar process, the mandible, the maxilla, the zygomatic bone, and these are the temporal lines. So we talk about the second part now. This is the lateral view of a skull. So when we see on a side, we are going to see this frontal bone again. Then there is an inferior temporal line. These are two temporal lines which are very minute, not visible on this picture. But yeah, there is a very minute two lines, one over here and one over here. The upper one is called as superior temporal line, whereas the lower one is called as inferior temporal line. This bone, there's a big bone, it's called as parietal bone. This is called as parietal bone. After that, this bone is called as temporal bone, and this is having part, so squamous part of the temporal bone is visible over here. After that, we can see the supramastroid crest. This is this crest. This is a line over here called a supramastroid crest. Then we see two major points that generally is being asked now. Why was that? Is stereon and asterion. So we are generally asked to point this out. So this point in the front, where these are sutures, just in front of that there is a point stereon. This is important because this is the weakest point of the skull. Any major fracture or injury in this area is really extremely harmful. You know why? I'm gonna tell you just in a minute. So, see this lateral part. This is the orbit. This is the zygomatic bone that we see in the front. This is the infraorbital foramen that we see in the front. The maxilla, body of the mandible. This is the body of the mandible. This is the mental foramen from where mental nerve comes out. This is the ramus of the mandible. This is the ramus. This is the body. Okay, these are the condyles. Okay. After that, we see this. This is a styloid process. This is something spike kind of thing. When we see from the external acoustic meatus, something bony part is coming out. This is the styloid process. This is external acoustic meatus. When we see something hollow cavity over here called as external acoustic meatus. A prominent line or bone prominence can be felt. This is actually a zygomatic arch when we used to touch it. Then now these are the sutures as I told you earlier. So this is the coronal suture. This is the coronal suture. Frontal and parietal bone combines via coronal suture. After that, when we see lambdoid suture, this is again parietal and occipital bone combined over here called as lambdoid suture. So this is the lateral view. The next, this is the colored picture. You can see the coronal suture, the frontal bone, the temporal bone, the stereon, nasal bone, zygomatic bone, maxilla, body of mandible, as I told you. After that, this big part, this big is parietal bone. This part is squamous bone. See, now the stereon is quite clear over here. This is the lambdoid suture. This is the mastroid process. This temporal bone is having two parts that we can see in this lateral view. This is called as a squamous part, and this is the mastroid part of the wholly solely called as temporal bone. External acoustic meatus, this is the styloid process, and this is the ramus of mandible. Next slide. So generally we are going to ask, tell me the suprameatal triangle, where it is located. So see, you can easily check this out. This is the external acoustic meatus, and just when we draw a vertical tangent from this line, a boundary of an imaginary triangle is formed. See, this is the zygomatic crest. You can just feel it. This is the temporal bone squamous part. This is the mastroid part. This is the zygomatic bone prominence. So From here, the suprameatal triangle form. Below it, it is the external costic meatus. Above it, the zygomatic prominence. On the side is the mastoid process. Okay. Now, as I told you why I say pterion is the weakest point as well as very important to be known as, because if an injury occurs over here, it may heal. Its healing may take time and it's going to be serious. Why? Because this is a maxillary artery. Maxillary artery and the middle meningeal artery. See, maxillary artery is going over here, whereas the middle meningeal is going, and it is dividing in two parts, posterior part and the anterior branch. And this anterior branch just crosses from this point, as well as this point is weakest. If any injury or any fracture occur over here, this artery is going to be directly affected and it may give a lot of harm. So as well as this is weakest and it's going to have major harm, that's why it is the critical area in skull. Next is the norma occipitalis. That is when we see the back side of the skull. There are number of sutures when we see over here. So let me tell you, this is the parietal bone. These are paired bones, this and this parietal bone, having two foramen over here. Okay. After that, these parietal foramen, they combine with each other. They connect via sagittal suture. Then we come down. There is a lambda. There is connection point of three sutures called as lambda. Lambdoid suture is this. What? This is the parietal bone and this is the occipital bone. It's combined with that via lambdoid suture. This is the squamous part of the temporal bone that we have seen in the previous slide. This is the squamous part. When I'm going to turn this out, I'm going to see this part. So this is squamous part. If we see this part, this is the mastoid part. Now see, this is squamous part of the temporal bone. This is temporal bone, mastoid part of the temporal bone, and this is the mastoid process, which I am going to see over here. There are two lines. These are not very much prominent when we see, but yeah, you can see, you can feel them. There is a superior nuchal line and inferior nuchal line. This big single bone is the occipital bone. And one thing is, there is a external occipital protuberance. You can see over here, this is a prominent part in the occipital bone. And this is the suture. This is the connecting point of three suture, that is the sagittal as well as two lambdoid suture called as lambda. Okay. Thank you for the part 1. We will connect later for the part 2. Please subscribe these videos and like, share and comment.